Harlan has been the architect of an outcome measure used by Medicare. And maybe you could start us off with some examples or an example of how big data thinking has the potential to really impact the way we think about patient care.
Yeah, I think we wanted to start off positive. Big data, you see the name of this panel. It means a lot of different things to a lot of different people. But one of the questions is, to what degree has big data helped us to improve what we really care about, which is the end results of care for patients? I'm a cardiologist and have worked quite extensively with the American College of Cardiology and the American Heart Association and professionals around the country thinking about how we can make use of data that are available. And just want to give one quick example, and also to say I think we're just in the first half of the first inning here. I mean, when we talk about big data, we are just beginning to scratch the surface on this. But you go back about 10 years and really no insight into any sort of the performance metrics that we would care a lot about, like if you had a heart attack, how quickly would you be treated at the hospital? How are hospitals doing with that? And when we finally start getting some data, granular data at the hospital level, we recognize that at some places you might sit for 2.5 hours before an emergency procedure might be performed that could save your life. And we know that every minute counts. So each one of those minutes was adding to your risk, and many people were dying unnecessarily because of the delays. By being able to focus on the data, understanding the patterns around the country, isolating who was doing it best, then digging in and understanding what were their processes, how did they achieve that top performance, and then generalizing it in a kind of good to great mode, where you say, now we've looked at hundreds, thousand hospitals around the country, and we've figured out the top 20. What do they do and spread it? We've gone from a situation where the average times were just about 2 hours. Someone would come in the emergency room with an emergency heart attack, needed immediate procedure. In the median time, half the people would be treated under 2 hours. We're down to a place now where 90% of people are treated within 90 minutes, which is at least our recommendation. But in many places around the country, they're breaking the hour mark, a time that they thought impossible before. Would have been impossible for us to appreciate that it was what the current levels of performance were or how we got to better levels. So while there's much more to do, this is an example of where we're driving down. You see overall,